Good afternoon, everyone. Will Dupree here in the KXAN Live studio. We're about to bring you a virtual press conference with officials from the University of Texas at Austin. Earlier today, they released their plans for what the fall semester will look like for both faculty members, staff members, and students. On top of that, you can see there at the bottom of your screen, this plan will include 3 options for students, so they can choose in-person classes. Classes will be only at 40% capacity if they do that. Online classes or a combination of the two. Mask will also be required for students and staff members while they're out and about attending classes or walking around campus. So let's take a listen as these different officials speak about the plan that was unveiled just earlier today.
4 of our working groups. Art Markman, who's the chair of the academic planning working group, and who's one of the 2 guys on your head, so you hear him all the time. Amy Young, who's the chair of the health and wellness group, Dr. Young from Dell Medical School. Soncia Reagan's Lilly, who's our vice president and dean of students, who oversaw the student life and engagement working group. And Allison Preston, who's the interim vice president for research and was the chair of the research working group. Daryl Bazell could not be with us from the operations group, so if you have detailed operations questions, we'll follow up after the meeting. We'll post the titles, everybody's titles, in the chat area. So with that, I'm going to hand it over to Interim President Hartzell for some opening remarks, and then we're going to hear from the other guests, just a couple quick takeaways on each of their areas, and then we'll go right into the questions. So President Hartzell, please take it away.
Thanks, JB, and thank you all for joining us today. And it feels nice to reach this point where we could come out to our community and talk about our fall plans. This has been a huge effort by a very large team, and I think there are over 250 different faculty, staff, and students who have worked on this plan. And I feel very fortunate that we have the kind of talent at our disposal to work on this that we do. And we've come out with this really trying to sort of blend or accommodate a couple of big objectives. One is, first and foremost, how do we keep our community healthy and safe? But also, how can we, while doing that, how can we also reignite part of what makes this place so special, our teaching and research? And so we've come up with a framework for balancing these things, protecting the health and safety of our people, while also relaunching the ways we teach and conduct research. And meanwhile, also the framework is set up so that as a disease progresses, becomes more or less active in our community, that we have the ability to adjust. And so we know that we may have to make decisions as we go ahead as this unfolds. And so we've been thinking through how we can adjust the ways we teach, do research, and conduct all of our campus operations depending on how the virus unfolds. So with that, JB, I'll turn it back over to you.
Sure, and I'm just going to go quickly to 4 of the working group chairs and get a couple key takeaways from their group. Art Markman, I'll start with you from the academics working group.
Thanks, JB. On the academics working group, because we were really focused on creating both a safe and effective education experience, we focused both on those classes that will have to move online. And we had an online education task force that really put together an extensive array of materials for our faculty to improve their ability to teach online, particularly for those faculty who are somewhat new at that. On the in-person side, we focused a lot on improving the safety of our classrooms in light of the pandemic by reducing capacity and by providing opportunities for lecture capture and other things so that those students who are unable to attend a class can still get all of the materials.
Next. Allison on research, Allison Preston.
Sure. So with research, our goal has been to maintain research productivity, both by maintaining ultra-low density on our on-campus operations, but helping support many of our researchers who have transitioned successfully to doing research remotely, much of which has actually had a direct impact on our response to the pandemic.
Thank you. Amy Young for the Health and Wellness Group. Oh, you're muted, Amy.
We've had several task force working on various areas, but we have created guidance documents that have helped all of the other teams really adapt the best science and public health recommendations to keep the campus community as safe as possible. We've worked regularly around testing capacity, building capacity for both those that are potentially sick or symptomatic, and have developed some recommendations around proactive community testing. And then lastly, we've had a team working on mental health and well-being for the students, the staff, and the faculty as well.
Thank you. And Suncia Reagans-Lilly for student life and engagement, please.
Hi, yes, I'm very excited to welcome our students back in the fall. And we know that we need to do that by thinking about ways in which they will engage the community. And so multiple subcommittees working on clubs and organizations, as well as student input in our planning. We've also considered housing and dining and density and social distancing, and created frameworks to really guide our work as we welcome our students back.
Great. All right, and I see we have some good questions coming up, quite a few. So let me start right in. The first two are similar, from Laura Cordy and Ava Maria Ayala. UT officials have said multiple times this semester will be different than any other. Why is UT not reducing tuition for this semester, especially if some students will be enrolled completely online? And a similar question from Ava Marie, what factors played into not changing tuition rates?
So I'll take that, JB. A few things I think are important to note to think about tuition and how we arrived at the decision to leave tuition where it is. First, as you all probably appreciate, UT represents one of the very best values in higher education in the country, and will continue to do so. The tuition that our students pay is only a small fraction of the entire cost of delivering what we do. So it's just one piece of the overall cost structure and the puzzle of how we piece together our funding and our operations. When we talked about why we came up with online and face-to-face courses and how we set the tuition, a few things that I think are also worth noting. One is we've been delivering very high quality online courses now for quite some time, and we've been charging the same tuition rates for those courses as for our face-to-face classes. Then as we took that experience and looked forward, and looked at how we wanted to provide a mix of classes, the mix we arrived at between online and face-to-face instruction was not at all set by a cost question, that we thought it was cheaper to go one way or the other. It was really about a balance between how can we conduct high-quality teaching while doing so safely, and what's the best for that particular class for our students. So some classes are better situated to be delivered online than others, and so we took that into consideration as well. And the final point I would make on the tuition question is note that Art and his team have been working really hard to make sure that we deliver these online courses at extremely high quality. So there's a committee underway looking at how we can innovate in the classroom, how we can use these online tools, and really ideally make the class just as valuable to our students as it would have been if it were face-to-face.
Great. Thank you. Claire from KUT asks, what's the point of staggering and reducing in-person class sizes if you're going to allow thousands of students to live and eat in close quarters?
Sure. So a couple of things there that this is bringing up, both why we're staggering in the classrooms as well as how we're thinking about the close quarters. So first, Dr. Young, do you want to talk a little bit about the overall guidelines you thought about for how we could be safe as a campus with students and residents?
Sure, thanks, Jay. So I think the student behaviors that we're recommending for both on and off campus. And it's really a set or a layered structure of behaviors that we would ask the students to follow, as well as the staff and the faculty. And those involve everything from masking and social distancing, decreasing density in spaces that allow not only decreased density in the classroom, but common areas, but also checking on daily symptoms so that folks that may not really realize they're symptomatic from disease that we can test those individuals and decrease the risk of contagion of those folks from other areas. So the behaviors that we're recommending for both on-campus and off-campus environments.
And then Dr. Lilly, do you want to talk about how we thought about residence halls and dining facilities?
Absolutely. So residence life, it will look different in terms of ways in which we will manage density, ways in which we will manage our common areas, and we're also allowing those students to have some choice in terms of their living accommodations. So while we're returning, it will look different, and we are paying attention to all of the safeguards that we need to put in place to keep our students safe.
Great. And now a question from Brittany Brito at the Houston Chronicle. The release talked about how classes that will be offered online have been designed for that format from the ground up. Can you talk a little bit about how that was done and how that design differs from how classes were typically designed for in-person instruction? How does this new online approach differ from how online classes were held before? You know, what are the enhancements?
Yeah. Art, do you want to take that?
Sure. Thanks, Jay. Yeah, it's a great question. You know, as Jay pointed out earlier, we have been teaching classes online here for quite a long time. We've learned a lot of valuable lessons. So, for example, our liberal arts ITS group has developed a number of studio quality spaces where we can broadcast our classes, and that actually enables a number of different things. It enables us to break our classes, even a class that's being streamed out live, to break it into segments that actually engage people's attention and allow us to bring guests into the studio for interviews in class settings. We can do innovative things like give regular quizzes during the class, which enable our students forces the students really to keep up with the reading, which actually helps their performance, not just in that class, but in all of the other classes they take, because they learn the valuable lesson of being caught up in their classes. It also enables us to put some materials available, not at a specified time, but for students to watch those materials on an as-needed basis, so that if a student actually works best in the evening, then they might be able to watch it then, or to go back to that material later. And so in a variety of ways, that online experience enables us to spread the class out over time in different ways and to bring in different formats that aren't available otherwise.
A question from Acacia Coronado at the Associated Press. In regard to residence halls, will single occupancy cost more than double occupancy, and if so, how much? Will communal hallway bathrooms still be available for students, or only private bathrooms?
Santia, is that you?
That is me, thank you. Our rates will remain the same. So single rooms do cost more than our double occupancy rooms. I would have to get back with you with the exact rate. In terms of the second part of that question, JB?
Will communal hallway bathrooms still be available for students, or only private bathrooms?
We will have communal bathrooms still available. However, students will arrange and have appointed times by which they will take their showers. We are installing plexiglass between sinks or as appropriate. And so there will be measures in place to ensure proper use of those communal facilities.
And the rates, as I recall, because I have to look them up for reporters a lot, they are online. So, yeah. All right, another question from Laura Cordy at The Statesman. Are there any efforts or measures UT can take to prevent contagion among students off campus, such as at Greek life parties or other social gatherings?
Sure. So I'll hit on a couple things, and I can turn it over, and Santia, you can follow up. But one is that part of what we're really working on, and it comes across from the branding you've seen, probably from today's announcement from our website, is this idea of protect Texas together. So part of what we're doing is trying to instill in our students a sense of doing the right thing, even when they're not in the classroom or in our dorms or residence halls. So we'd like for them to be thinking about each other, to thinking about the broader community, whether that's our faculty, our staff, or Austin at large, as they think about whether they go to a party that night, or on the weekend. So it's trying to get the behaviors to do that. And, part of this is an exercise in trust, that we're entrusting that our students will be able to do the right things as we go forward. And Dr. Lilly, I'll let you see if you want to follow up with that.
Absolutely, and the trust is a key factor. Many of our students are living in the community now, and the guidelines that have been produced, we are regularly working with our private dorm associations. We work with tenant developers. That's not quite the right word. Work with those who own and manage various facilities, and we are sharing those guidelines. We also have an off-campus resource office working with heavily dense populations throughout the Austin community. So we are going to continue to work with our students, and we work with our house corporations that own and manage many of the fraternity and sorority houses, and they are all a part of this, and we're in this together, and we're going to protect Texas together by working closely and reinforcing and supporting each other as we trust our students to do the right things and to make good choices.
Thank you. From Ava Maria again, what will be the protocol if a student needs to be isolated and is not able to travel or have another place to stay? What will the community partnerships be to address this, helping students self-isolate?
Sure. So is that, Amy, is that you?
I can address that. So we've been working closely with Austin Public Health, and here at the medical school, we've worked closely with them since the beginning of the outbreak. And so we have made arrangements to work with Austin Public Health to place students that couldn't travel home or can't isolate where they currently are in the isolation facilities here within the city. So those arrangements have been made.
Great. Thank you. Then a follow-up on the responsibility questions here. Are there going to be actual consequences for not social distancing or wearing masks? Or are we just hoping students follow direction when they are not in classrooms? If there are consequences, well, let me stick to that question first from Claire. Are there actual consequences for not social distancing or wearing masks?
Yeah, so I'll start off at a high level and then I'll hand it over to you, Sancia. So, at a high level, we do now have a masking policy in place. And whether you're a faculty member, a staff member, or a student, then we have traditional discipline guidelines, if you will, of what we do for people in our community that don't follow our policies. And so we know how to go down that path if for faculty or staff or students, depending on kind of which bucket that person's in and what the issue is. So we expect the mask to be one more policy that we will implement and worry about it if people aren't following it. Sancia, I'll hand it over to you if you want to hit on details from the student standpoint.
Okay, that was an excellent response, and we're expecting students to refer. We're expecting faculty, staff, community members to refer. We currently have protocols in place for us to receive those referrals and to follow up and to speak with students to understand case by case why they're making the decisions that they're making, and then we follow our normal protocol as it relates to student conduct, and that can be a warning all the way up to deferred suspension, but our approach wants to be more of understanding with high expectations, and then when we have to, there will be those consequences that already exist.
All right. Another question from Claire. What are the contingency plans if an outbreak happens or continues here in Austin? So it's a general question about contingency plans, but particularly if an outbreak expands or continues.
Yeah, so at a high level, you can imagine sort of two endpoints. One is pre-COVID, business as usual, campus open as we have known it for many, many years. On the other endpoint is something that looks like the end of last spring, where everything was online, very minimal staff and faculty on campus. Events shut down. Dr. Preston's labs were closed, except for a few doing COVID research and some other research. So those two endpoints, we're going to start somewhere in the middle, and knowing that we may have to move in one direction or the other as the disease progresses. And so what would that look like? So for example, If we need to get more restrictive, we might move more classes online. Some of our hybrid classes might to have more online sessions and fewer face-to-face sessions. The density in Allie's labs might be reduced, for example. Meanwhile, if the disease gets better, in some sense, we might be able to do more things face-to-face, more events, more face-to-face meetings with faculty, more density in our research labs. So that's a sense in which we know we're in the middle of the start, or we expect to be. It's roughly 2 months from now, and we'll move one direction or the other as the disease changes.
Great. Anything to add for the contingency plans before I move on? Okay. Yeah.
Maybe I can just add, from a health perspective, there are many things that have to be taken into account and consideration related to what phase we're in. We're closely related, or we're closely connected to the healthcare officials in our community. So we're closely monitoring, for example, the testing environment here within Austin. We're testing hospital capacity. We're developing some measures that we would look at, on campus. A part of it depends on, whether there's a distribution or if it's an isolated area or event, and our ability to manage all of those things. So I think that we've been very thoughtful, and my team has been very thoughtful in making recommendations in this particular space.
Thanks. Question from Ava Marie. How many students are expecting to physically be on campus in the fall?
It's a great question. I'm not sure if any of us know a hard answer. We had students register for classes back before we knew the full array of what we were going to be able to offer. So they registered based on kind of pre-COVID course schedule planning. There'll be some reshuffling. We expect some changes there. We'll also see how many of our incoming first-year students choose to opt to be here in person. Another big question mark is for our international students who have some at the undergraduate level, and another big set of those students at the graduate level. Can they get here? And can they get here safely, and when? So I don't think we know, but I'm open if somebody else on our team wants to opine on what we're expecting.
Great. I think I can try to work in the last three questions. Some people said their questions were answered. So quick one from Laura. If professors don't want to teach in person, are they allowed to teach remotely, or are they required to have a claim through the Americans with Disabilities Act?
Yeah, we're working right now with all of the departments and colleges and schools to try to figure out how we can best serve our students while also accommodating our faculty members' health needs, concerns, or constraints. And so you can think about, the top priorities, faculty who have their own health concerns, we're going to find a way to accommodate them. We might also have faculty who have a health concern, for example, a family member in his or her home, where we're going to find a different way to accommodate them in our course schedule. And then we'll have some that might prefer one format or the other, and we're going to have to work through how we allocate the faculty across our course schedule in a way that allow us still to deliver, a world-class education to our students. So that's where we remain. We still have to work through all the details of that between now and the semester starting. But I'm confident in our ability to come up with a set of courses that will be robust, where our faculty will be able to do what they do so well.
Thank you. Does UT plan to conduct tests? This is from Melanie Barden. Does UT plan to conduct testing for students to help with the city's efforts and get a better idea of how the virus is spreading specifically on campus? Is that for Amy?
Yep. How about Amy?
So we have been planning for capacity to make sure we take care of our students who are symptomatic that might actually have COVID, but as well as to do some proactive community testing on campus to have a better understanding what the prevalence of disease is amongst asymptomatic students. And so we're still working out the details around the testing, but that's in our plans right now.
And then what's the deadline for them? I think it means for students. This is from Ava Marie. What's the deadline for students to decide whether they go online or in person?
So I think of this as a course scheduling process. The students who have already registered have a set of courses now. They're going to learn which of those courses will be delivered online versus in a hybrid or in-person format. And they'll have a chance to add drop just like they always do. And they'll have to decide if they want to juggle their courses for any kind of reason once they see kind of the new full course schedule and those options. And Art, I don't know if there's anything else I missed that you want to add.
No, you got it.
Okay. Let me take one last question, and I'm going to have to finish up before addressing every question in the thread. So for Alex, I'll follow up with you afterwards. And Acacia, you had a furlough question we'll follow up with afterwards. But your other question is, are the classes that are going online correspondent with specific years, such as mostly freshman or sophomore classes? Art, is that?
I'm happy to take that. The first thing with classes that went online was that our largest lectures we put online for reasons of capacity in classrooms. So we're maximizing the capacity in classrooms at 40% of the overall occupancy, and so our largest 400 classes went online as a result of that. So after that, it really was up to departments to look carefully at classes and make decisions about what made most sense educationally for those particular classes. And so while many of the largest lecture classes tend to be lower division classes, so aimed at first and second year students, a number of the other classes that were smaller classes that still made sense to teach online were ones that affected more senior students.
And just maybe if I can just one last thought on that, just we are going through special efforts to make sure as we go through and run scenarios that look at our first year students and make sure that they have a very good in-person experience. The other thing we're doing is even for classes that may be primarily online or fully online, we're compiling ways that faculty or teaching assistants or other components can interact with students on a personal level.
Thank you. And there's a variation of the testing question. I said I was at the last one, but I saw, Amy, you might have just about answered this, but is there any special coronavirus testing available for students on campus?
So we're currently doing PCR testing, which is the same kind of testing that's being done in the community. It's being offered on campus for students, faculty, and staff at University Health Services and also at UT Health Austin. We've done some of the proactive community testing. We intend to scale that up on campus. Similar type of testing that's being offered in the community. It's just easier to access for our students and our faculty and staff.
All right, thank you very much to all the reporters. Please email the media relations account or me or Ellie or Matt Penny, and we will continue to follow up with you after this briefing. We know you're going to have more questions in the days and weeks to come, and we want to help you get those answered. Thank you to our participants, and we'll see you at the next briefing. Thank you very much.
Will Dupree here again in the KXAN live studio. We've just seen the conclusion of the press conference that UT officials here in Austin had held to talk about what the plans are for this fall semester. I know a lot of parents will be wondering about that, seeing if their students are going to be able to go to campus in just a few months. We do have a full write-up on what the plan is that was released a little bit earlier today. That's over on our website, kxan.com, and the KXAN News app. I thought it was particularly interesting to note that the officials were asked how can they enforce students to wear masks and practice appropriate distancing when they're not in a particular building, on campus, or walking around the campus. And they said that they are going to trust that the students do the right thing. And I know that will be very difficult, but I just wanted to point that out because that was mentioned earlier in this news conference. Once again, we do have a full write-up on everything over on our website. I will point out as well that what is going to be happening is that students will soon find out that the classes that they signed up for, so some of those upperclassmen who've already signed up for classes, will find out what format their classes will be held in. So they could be all online. They could have some in-person instruction. If they do, classes will only be allowed to have 40% capacity, or there could be a combination of both. So some of it could be online, some of it could be held in person. That will be found out very soon by students out there, so please, I would imagine, keep track of what communication comes from UT Austin to all of you. We thank you all again for watching. I'm Will Dupree, and we'll see you back here a little later today with some additional updates. We have an interview coming up at 6 o'clock during our newscast, so KXAN News at 6 with Governor Greg Abbott. He's going to be joining us for an interview about the response to the coronavirus as cases keep skyrocketing and hospitalizations are hitting record levels day after day. We will bring that to you live here on our streaming platforms on Facebook, KXAN.com, and the KXAN News app at 6 o'clock. So we'll hope to see you then. Have a good one, everybody. Please stay safe and healthy, and if at all possible, still at home.